Thank you so much, Lisa. And I don't know if you knew this, but you wore the color of migraine awareness today, which is why I'm wearing this jacket. Um, so for the last 791 consecutive days, I've had a continuous headache. It is not a migraine. If it were, I would probably not be standing here right now. I'd be incapacitated. Mine feels like I'm wearing a helmet that's 2 sizes too small. And while it is extremely annoying, and I wish it would go ahead and finish, I'm thankful for it. I'm thankful for it because without it, I would have never met the co-founder of Global Migraine Aid, Dr. Rami Burstein. Now, Rami is up at Harvard. He's the president of the International Headache Society. And if I listed all his accomplishments, I would run out of time. But Rami, when I met with him the very first time, told me a story. And the story has effectively changed my life because of the direction of this past 18 months. The story is one of disappointment. We have over a billion, 1.16 billion individuals in the world that are suffering from migraine. And we have enough neurologists and headache care specialists to only treat a small fraction. What's worse is we have medicine that was created 40 years ago, approved by the FDA in the early 90s in the US, is now generic, only costs 10 cents a pill to manufacture, and you only have to take it when the migraines are coming on. It does not work for everyone. This is not a perfect solution, but if you could help 70% of 1.16 billion people, then you should probably do it. And if you can help people for 10 cents and prevent them from missing 1 or 2 or 3 days of work, there's a pretty good return on investment that we will be talking more and more with the Drs. Elizabeth about afterwards. But we really do think that there is potentially some of the lowest hanging fruit, so to speak, one of the easiest wins in global healthcare. It has not been addressed yet, but it is there, and we've got a plan. So I'm standing here right now, and although I'm not the picture of health, I'm not bleeding, I'm not limping, I'm not, obviously in pain, although I've told you I am. And this is actually something that is part of the healthcare process for migraineurs. And it's one of the more difficult parts is after time, people don't want to hear about it anymore. People kind of don't believe you anymore. Your boss is kind of frustrated with you at work and says, are you really, having to miss yet another day? That's adding insult to the injury, right? So if you're a migraineur, you're already hard on yourself because you're already not able to look after your kids the way that you would like to, or you're not able to, help out around the house or to care for your aging parents, or you name it, any number of things that you would like to be more productive with your job at work. So the global impact that Rami was outlining for me was just immense. There's a recent think tank study that identified, I believe it was Argentina, Brazil, and Mexico alone suffer $55 billion per annum in socioeconomic burden. 55 billion. We're talking cents that could impact a significant portion of this solution. So what we have to then say, okay, it's a massive problem. Heretofore, nobody has really done too much about it. I cannot believe I just said heretofore. Sorry about that. I don't know where that came from. But, until now, there you go. Until now, nobody has, on a global scale, managed to impact this. So, one of the big things that we got to do is kind of figure out how do we motivate people? How do we get people to care? And my wife and I, this is a little side story. My wife and I's house flooded on Friday. We had the hurricane that came through the United States, flooded our house. As floodwaters come up into your house, you cannot help but think, God, would you please stop these waters from coming up, right? Or government, would you please have erected a barrier for this not to have happened? You kind of think out loud, I wish somebody was there to help me. I've read many accounts, history is littered with them, of people who are in situations of war or famine or slavery or horrible situations. And they think, surely if the world knew that I was in this situation, somebody would come help. Somebody would come stop this, prevent this. And I think relative to the hundreds of millions of mostly women, migraine is 75, 80% female affliction, that if folks only knew And if there's a solution that's not too far away, surely this would have been sorted out by now. So Dr. Burstein, when he was telling me all this, I really got angry more than anything. The old sort of wrestler in me, the old sort of, I have a more of a fight than a flight response, said, well, what the heck are we doing about this? Who's working on this? And so here's our next step. So we spent the last 18 months working on the solution. We built a collaboration of 15 global organizations that are all doing what they do best, right? We're working with people who already understand what it is that they do. We have a lot of work to go. We're not finished yet. We're looking forward to continuing our relationship with the Ministry of Health of Kenya today. As Kenya, by the way, is where we were looking to have about 100,000 patient pilot across Kenya, the Philippines, and then into Mexico into 2026. Migraine is a global issue. This is not 3 countries that are solely impacted. It just so happens to be those are 3 countries where we had some of the best relationships. And for example, the Catholic Church in Kenya has been an amazing partner thus far. They've got a network of thousands of clinics that they're opening up to us. The community health promoters in Kenya is a resource that not many countries have. I mean, you have to really think about what Kenya has been able to accomplish. And that's part of the reason what attracted us to be able to lean into the infrastructure that y'all have already built. And it's a testament to, if you build the infrastructure, all of the innovators in this room, and there's so many great projects, it's not just migraine's the only one, right? But all the innovators can work together from an end-to-end basis and work with collaborators and work with folks who are already good at what they, are good at. So from the outset, though, we are focused on open results, right? Transparency, trust. We're focused on local engagement, local-led training. All of the work that we're doing is geared toward, you should have journaled results in medical, public policy, economic journals that show the plan, right? That show the results. And if we actually do this right, we hope that there's no such thing as global migraine aid in 20 years, right? We hope that we are creating templates such that others just take the templates and run, and nothing would make us happier, right? So if we can go down that path, then our vision becomes that there are individuals who know that what they have is potentially migraine. There are local resources. You can't just have neurologists. We've already talked about that. It's got to extend to nurses and clinicians and community health promoters that are also being locally led, educated, and that we've got access to medicine. It's got to get to the country. It's got to be affordable. We're trying to provide it for free, but over time, even if you could get the cost down to 10 cents a pill, that's a lot better than it's not even in the pharmacy in the first place. So we've got a large potential impact. We've got a vision that we've got a succinct plan where people will be able to achieve at least some relief. Again, it's 70%, up to 70% would receive help, but that's enough, right? That's hundreds of millions of people that need help. We should go ahead and get started on that. So we think we've got, to some degree, it could be argued, the greatest global source of preventable pain, of easily preventable pain. We're talking about, this is pain that's at the doorstep. This is an intruder in your house. This is a bully about to smack you in the head, and you've got the potential ability to stop it. It's not that other initiatives aren't important, but sometimes you need to eat more healthily for the next 20 years to not have heart disease. Well, this is more right here and now. We've got, somebody coming after me and we want to stop it right at, cut it off at the pass. So we're excited about this new global protocol that we're trying to collaborate with others on. We're excited about trying to change the landscape of global migraine aid. Thank you very much.